Alrighty, Naomi, take it away.
Okay, great. So I think this is going to be a really productive meeting. We have the week of action stuff going on and a lot of movement. It's probably one, if not the last one of the few remaining larger group meetings before the start of the legislative session. So, all right, so I'm going to kick it back to Ting to tell you guys about a new reach up and follow up system that we're putting in place. And it's primarily for people who are like, we hand out those flyers and they have a QR code on it, and then they can fill out their information to sign up and get involved. And it's also for people who just fill out a postcard and then we input their information into the spreadsheet. Like once we started getting that going, we realized that like following up with those people is a really critical next step. And so we've started to establish that process. So Ting, you want to describe where we're at?
Okay, that's pretty much it. I mean, the idea is we have two dedicated people who aren't on tonight, unfortunately, Wendy and Colette, who have agreed to at least weekly go through the spreadsheet and calls and follow up on calling and try and move people to more action if they can. And so that seems to be, happening. Naomi can maybe tell you better how it's working, but just so that everybody knows, it is no longer a pit into which they fall and nothing happens. So there's two parts to it, actually. There's the calling part we've been talking about. Some people, of course, don't give us a phone number. And so there's an email that I take care of that goes out trying to get them to call us so that we can call them back and start that same process again. And it looks like this is going to be very helpful going forward. Just want to let everybody know.
Yeah, and it's, in a lot of ways, like, because we weren't sure, okay, exactly what should the process be? What information do you send them? All of that. Basically, what we tried to do is learn more about what the most effective like structure of follow-up is going to be, just based on those phone calls with people, so that we can better understand like who are the people that we're attracting, and like what kinds of follow-up is going to be most useful moving forward. But I think that having that human touch is that's like my favorite part of that. So, okay, I'll move on. The flyers, the distribution process for that. So I've mailed anybody who has given me their information wanting flyers, I have sent them out. Is there anybody who, yeah, Susan, so that's the next batch of printing that we're gonna do is postcards. Has anybody not received a flyer or like a set of flyers that's asked for it?
Oh.
You haven't gotten yours yet, Mary?
I haven't asked for it yet, but I need a badge, so that would be great.
We have a form where you can give us your information.
Right.
It's basically name, address, and how many you want.
Okay.
So maybe 100. Most people, it's been between 100 and 500.
Right.
Mostly 100 to 300.
How are we doing an inventory, Naomi? Do we have enough left?
Yeah, we've got like half of them left.
Oh, okay.
Yeah. So there is a, could anybody find the link to the form where you can sign up to get those flyers? And
Yeah, I can, give me a minute, I can do it.
Okay, so yeah, you can follow up with that. You can also just email me your name and address and number of flyers. So we printed 2,500 altogether. And so we have about half of those left. People, I think I sent it like last week or the end of the week before that, and it should be 5 to 7 business days. So you should be getting them within the next couple of days if you haven't gotten it yet. Probably by the end of this week. Yeah, so flyers, we're gonna probably print the same number, just because like, I mean, for the postcards, because postcards, like I think that we hand out a whole lot of flyers. We hand out more flyers than we do get postcards filled out, because that's like the subset of people who are actually willing to stay and fill everything out and everything. So if we get 2,500 postcards, we should be good for that.
Okay, that's in the chat.
Okay, great. We have the Spanish version up now. So if we have like a QR code on the flyer that is just the Spanish version of the website. So that link is working now. I'm not really familiar with this. What is the labor outreach flyer?
Oh wait, no. Sure. So that was some output of the labor working group. It's basically a revision of a flyer that existed previously. It's specifically for union members, making the case for the New York Health Act and giving them some action items. Now, as is, it directs them to the Campaign for New York Health. If the person-to-person working group wanted to adapt it, or I could do it for you for NYPAN and our QR code, that's easy to do as well. But right now it has a list of things that you can do if you're a union member and you want to get more involved or learn more about the New York Health Act, and makes the general case for geared toward folks in unions for the New York Health Act. And there's a link to it in the agenda. I'll also put that link in the chat in case anybody wants to download that, print it, use it.
I already did, Jeff.
It's actually very helpful. Oh, perfect. Thanks, Tim.
Okay, and then the next thing is just that we're going to be printing up these postcards. I can show, and I think there's a link to these in the agenda as well, but I'll put it in the chat. There you go. If you're curious and if you want to get copies of these postcards mailed to you, I know in the form, if you filled out the form and you put like a number for number of flyers and a number for the number of postcards, then we'll have that information. I'll just go back to the output from those forms. But if you didn't request any postcards and you would like to, send us that information, name, address, and number of postcards that you want printed, and we'll get those printed and then mailed out. It'll be probably a couple of weeks before I mail them out, so definitely I would say December that you'll actually receive a postcard. Okay, Carrie and then Steve Auerbach.
Yeah, I want to know if because apparently this thing for unions is available to us now, but I would love to have it with the version for NYPAN. Is it editable by us? That's one question. And another question is, can I get the postcard to print myself, because they won't be ready in time for when we're doing tabling next week?
The links in the chat and in the agenda, Carrie, you can just print those. They're PDFs.
Right, and to answer your other question, Carrie, yes, if you download that file, then it's editable. But I'm happy to do that as well. I would just need, what we're putting on our existing flyers from you guys, so that I can put that onto the labor flyer. It's a good thing to have it, like if you're canvassing or tabling, on the table for union members. But again, it's super easy to adapt. So just send me what you guys want to have on it, and I'll do the work.
Great.
Thank you.
Thank
Do
you.
you think that we're going to have postcards in time for the Week of Action thing?
Where are we now? Yes, probably. There may be, but distribution may be the difficulty. We'll have them here in New York, and whether we can get them upstate in time, I'm not sure.
Okay. Okay. Well, the good thing about these postcards is that I don't think you have to print in color. So if you
No.
got to print some out, you can. I think it's a lot easier to do that.
You
The
can
key thing,
distribute
though-
them at the rally.
The key thing on the cards is we're going to print them in a very thick stock, because bulk is the key here. And if anybody remembers going to Albany a few years ago, but we had printed on thin stock and it didn't look like that many. Even if you gave a senator 500, it was only a little tiny pile.
I've
So-
used postcard stock, but it's 4 up, like the Avery, and I need to have a mechanical that has it 4 on the front and 4 on the back.
That's the way it is. Look at the links.
Okay.
on the agenda.
And is that what's on the agenda where it says front
Yes.
and back?
Yes.
Thank you.
Steve, you got a question? Trying to unmute.
Sorry, a moment to unmute. One of the standard reasons for labor to be in favor of New York Health Act or single payer is getting health off of the bargaining table. That's not on this particular version of the flyer. I'm just curious. It seems like it's such a basic thing for labor.
Sure it is. Literally, the phrase "get health benefits off the table" is on the flyer. It's under worker power.
Did I miss it? My apologies.
Yeah.
If I missed it.
But it's a good
My
point,
bad.
because that's a major selling point for unions and
No.
and the leadership, not just
Yeah,
the rank
no.
and file.
My bad if I missed it. I just.
So possibly that
It's
needs
up.
to be
You're
bumped
saying,
up a
okay,
little
there
bit.
it is. No longer. Yeah, no longer causes strikes. Okay, off the table. Okay. Yeah. I'm used to seeing it as its own bold. I mean, the equivalent of being in the green. Not a problem. My bad.
Yeah, Bob, go ahead.
Of course, there are some union leaderships that really like their welfare funds and get a lot of jobs out of them. And so that argument will not go with them, but it would go with the rank and file. So it just,
Yeah, I think that's what people are running into with the Medicare Advantage plan.
right.
They're getting the difference in welfare. Okay, so all right, that's the update on flyers and
There it is.
postcards.
Okay, missed it.
All right, so the medical professional working group, the doctors working group, we have these 2 letters that people can bring to their doctor's offices with them. Or you can go around to different, or it's not just doctors, well, yeah, basically clinics, whatever it is, hospital, healthcare providers, medical care providers. It's just like information. It's, it's like the labor outreach, except it's outreach to medical providers. So you can take them, and anybody in your networks, in your NYPAN chapters or whatever it is, can print these out and bring these to provider offices. Yeah, Susan.
I just wanted to add that we haven't met in a couple of weeks, but in regards to this, these provider letters, we're also looking at is just healthcare professionals who are not physicians, to be able to get petitions for healthcare workers that could be working as aides or RNs, or they're chiropractors or doctors of osteopathy, or dentists, or other physical therapists, other people who are in the medical profession, could be even pharmacists, that we can get on board as well, and not only for physicians, because there are other people oftentimes working in these offices, nurse practitioners, physician's assistants. We'd like to have those people
Raise
on
our
board
hand.
as well.
Make a point to thing.
Yeah, that's a great point. And those are people who, well, probably outnumber physicians, and also who like interact with patients more, and so they might have more of a
In chat, or is it behind? Oh, yeah. But it's you.
better understanding of what people are going through. So yeah, just to let people know that those letters exist, they've been workshopped and everything, and that we can use them and encourage people to, to use them as well. Because a lot of providers don't know about the New York Health Act. Yeah, Carrie.
Yeah, it's actually Donald. Just off
Okay,
that.
right. So I think that you're next on the agenda, and you're going to talk about how to bring
Okay. We'll get to the detail then. Okay.
doctors
Go.
back into the practice.
Yeah. You want to do it?
Where are we?
We're up to us.
So I've lost my place.
Item 6.
The 2 letters, did you start to?
Yeah, we
Naomi, I
did
was-
item 5. We're on item 6 in the agenda.
Item 6, candidate pledge.
No.
No.
That's 7.
Well, actually,
So,
4.
so 4, and when it was adjusted, is that there were these 2 letters. So you want,
Yeah.
so-
Can you put the links for those 2 letters into the Google link
Yeah.
into the chat?
Yeah,
Do we have
there's so many links that I would rather keep them in the agenda, have the people to save the one link to the agenda, and then they got everything.
right,
Oh, they're in the agenda.
yeah.
Yes.
Okay.
So
Good.
basically, the first line of defense is that all of us go to doctors. And whenever you go to a doctor, you can just have a conversation with your doctor. By the way, have you heard of the New York Health Act? And ask that, can you leave some literature for about the New York Health Act? And you know, because he's probably not going to take, he or she probably won't take it, but you would leave it at the front desk. And in that letter, it's saying that we can arrange to make a presentation to their staff and colleagues, or, you know, anything that they would want, and with further contact information, and it directs them to the
Website, PNHP website.
PNHP website. So, you know, just, you got to remember that if we're all in this, we all have to be thinking about this when we go to our doctors. And the other thing, that the next level is the provider to provider. If the doctor is ready, you are asking the doctor to please ask their colleagues to take, if they know about this, and to share this information with their colleagues. Because pretty much we find that a lot of people in the medical profession, and I'm glad that Susan mentioned that there's a lot more than just in the medical profession than just medical doctors. There's, yes, pharmacists and physical therapists and chiropractors and acupuncturists. We could tell any practitioner that we go to, we can talk to them about the New York Health Act, and we do. And it's not a bad idea to also always carry the flyers with you whenever you go to a doctor's office, because you never know who you're going to have a chat with when you're in the waiting room, or talking to the nurses when they're signing you in. You know, everybody is another opportunity. Every person that you see their face and you hear their voice and they hear your voice, it's another opportunity. Don't lose those opportunities. More?
More. And off that, item 5, can you all hear me?
Yeah, but Don, you guys printed it out when the numbers were different.
What numbers?
Number 5, for instance.
Oh,
So just tell us
Oh.
what you're talking about. Rather than,
oh, sorry, on the agenda. Off of what Carrie just said about the medical professionals, Susan and I were meeting, and somebody accidentally jumped into the meeting, and it ended up she was a doctor. And then beyond that, she was a burned out doctor, a burned out physician. So while she said she loved what we were doing, and she loved what we were talking about, and she was all excited about the act, she didn't have a whole lot of time to give to us or to the group, but that she would do whatever she could. But she talked to us at length about the burnout issues, which you've heard about, you're all aware of it. I saw.
Is everybody aware of it?
Everybody knows that doctors are burning out. I've heard that up to 30% of doctors are leaving the practice, and she confirmed that. So, I mean, this is a crisis. We're in the middle of a crisis. So the act couldn't come at a better time in a way. Then subsequently, Dr. Steve sent me a link to an article in, I think it's Stat Magazine, STAT, Steve, is that right?
Yeah, I mean, it's
By a doctor named, there was an article by a psychiatrist with a name that I can't pronounce, but I will put it in, I will make it available to you guys. Yeah, go ahead.
No. First of all, I wanted to say you did an outstanding job in developing these letters, and I've been distributing them to some other folks, and everybody's incredibly impressed.
Oh, yay.
So bravo to you in that process. When you have a chance, I want to address some of the things that have come up already.
Good.
Within this.
So we can take that offline, Steve?
Well, no, to this group. Some of the things that have just come up, I just wanted to also.
Why don't you jump on as soon as I'm done in about a minute? I only need one more minute. The psychiatrist was very, what's the word? The article was very emotional, and it was very clear on what the issues are. That she was talking about the time she spends in the office, and then when she goes home, she spends another 2 or 3 hours, to the exclusion of her family, dealing with paperwork. and fighting, and during the day, they're fighting off insurance companies who are dropping claims or who are refusing benefits and not telling the doctor. I mean, it just goes on and on. So we see this as a parallel effort to getting out to the providers. So if you hear anything from your providers about how underwater they are, let us know so we can see if we can probe this sub-community a little bit more deeply, because we think we can get real advocates out of these folks.
Mhm.
And that's, oh yeah, they're talking about investing in protocols. Actually, the healthcare insurance companies are talking about investing in protocols to deliver healthcare professional behavioral support to their physician networks. Now, take it with a grain of salt, but for example, Care Oregon and Blue Cross Blue Shield Michigan, of all companies, are learning how to support their providers with expanded telehealth systems. I mean, there is stuff going on. And apparently, the insurance companies are not stupid. They know we're out there, and they're trying to, give some level of support to the physicians. But anyway, there's a story there, and we're probing it. So we'll keep you guys posted. Steve, do you want to jump in?
Yeah, I mean, there's a ton of articles and ton of discussion within the healthcare provider community and the medical community on burnout. I mean, part of it is COVID, and part of it is just the continued exacerbation of the control that's been taken over by the managed care companies, all of that. This is a huge thing by PNHP, and always has been, but it just keeps getting worse because we're losing, not winning, about, physician autonomy would be better under single payer. Physician practice and lifestyle would be better under single payer. This has been a long time part of our spiel, and it's ever more so. So the only thing I would say on this is it's nothing new, and for the PNHP docs, it's quite old. I just wanted, in terms of the categories, one category of clinician that hadn't come up, and I dropped it into the chat. And one way we think about clinicians is, are they, and it's relevant to New York Health Act, are they autonomous billers? Are they able to actually bill insurance themselves, or are they practicing in effect secondary to somebody else? So an example, in New York State, dental hygienists don't practice by themselves. You may go to a dental office, only see the dental hygienist, but the billing is through the dentist license, not the dental hygienist. So, and especially in mental health, there are entire categories nobody's brought up today of mental health providers, licensed mental health counselors, licensed clinical social workers, and clinical psychologists, ID or PhD clinical psychologists. Similarly, it's the difference in the advanced practice nurses and the RNs. So just in terms of thinking about it, that's a way to think about independent practitioners that are relevant, and especially the mental health ones, somewhat similar to the dentists. They're used to having a certain degree of their own autonomy, and often not billing through insurance at all. And so some of them may actually be a little more dubious about the New York Health Act because they're fearful of what the reimbursement rates are, even more so than, let's say, a lot of the doctors, just because they've chosen to they're outside of insurance to a certain extent. So we've heard this from some of the mental health paraprofessionals that I mentioned before. And it's a potential issue in outreach to dentists. So we may need to do some research there and think about it.
Yeah. That's good. That's helpful, Steve. That really it enlarges our scope and our reach. So that's really important. And by the way, I sent an email to the author, this doctor who authored the article that you told me about. I haven't heard back from her. She's out of state. But I thought, why not share with her what we're doing? I think she's actually in Massachusetts.
Yeah, she's literally one of thousands.
Yeah. So it's an audience we want to try to get to as well. Susan, do you have anything you wanted to add on what you've been doing upstate, medical professionally speaking?
Yes, I'm going to be meeting with Wayne Strauss, the physician over in Penn Yan that Steve turned us on to. So he was a PNHP provider. He's a family practitioner. He still practices, and he's sort of getting the band back together again. And hopefully he's going to become more active. So we'll be speaking next week. But in regards to what Steve was talking about, I know a variety of mental health professionals that do their own billing, particularly those who have low income patient clientele, that they'll be submitting the claims themselves. People who have private insurance will have most of their costs taken care of for mental health professionals, but there's very few people there. I mean, there's a large population out there that does not seek mental health care because they can't afford it. And if someone is charging you $200 an hour and your health insurance covers 100 of it, you may not go back to them because that other extra 100 out of your pocket can't be paid for. So I think there is a lot of people who are in the mental health profession that are very interested in universal health care because they know about the paucity of coverage for the population at large. So I think that we can make an impact on that population. And psychiatrists actually are one of the more proponents of universal health care. It's really the really high income physicians that are against it. The ones who don't have very much patient contact, be they anesthesiologists or orthopedic surgeons, radiologists, those people who don't really get to see what the average patient is going through in their inability to pay for healthcare coverage, and also that the physicians are not going to be getting that much pay because the people that have health insurance, it's not adequate to cover the physician's costs.
Okay.
Okay,
Okay,
great.
Thanks, Susan. Naomi, go.
Yeah, and keep us posted on your upcoming meeting.
Sure.
Okay, so I think that basically the takeaway is that I think there are a number of medical care providers that are potentially game for this. You know, I like that distinction that those who have more interaction with patients might be, you know, like versus might be a little bit more likely to be on your side. So it's probably worth whoever you're interacting with, you know, to broach the subject. And we can use these great support tools from Donald and his group. All right, so Ting, let's go to electoral, the candidate pledge campaign.
Right, so thanks. The candidate pledge, a number of you may have used before in previous years, and electoral took on to do it this year, hopefully to have it done before the session starts, the legislative session in January. However, I'm running into difficulties, just procedural actually, with the campaign figuring out what the pledge should say this year and what the wording should be. So I don't actually even have the document at this point. And I told them today that if we don't get it pretty soon, that we're not going to be able to get this done before January, in which case we'll simply wait and start it in January and get it done before the budget is done. But it'd be nice to have it done earlier. So I'll keep everybody posted as soon as I actually have something we can use. And I'm really hoping that people in the group as a whole around the state can go after different electeds, whether or not you're part of the electoral working group.
All right, Maria, see you. Okay, so Ting, why does it really need to change from one year to the next?
Well, yes, and you'd think it wouldn't. However, at the end of last year's, on the document, there's a whole bunch of changes and fixes and countervailing arguments about things that should be one way or should be the other way. We shouldn't use the word pledge. Some people think, or there's all kind of different things, and they're trying to resolve all that so that a large population of people will feel comfortable using the form, whatever it turns out to be.
Okay, got it. That makes sense. All right. Keep us posted. Okay, so
Will do.
worker group, or the labor working group, Jeff.
Sure. So we actually haven't had a meeting since our last general meeting, but one potentially positive development that I have to thank Earl Kimmick for, he initiated the contact, is that I had a great conversation last week with the Eastern Regional President of United Electrical, forget the whole name of it, it's United Electrical and a few other things, union, which is a national union, and he's the Eastern president, but there are just two locals inside of the state of New York. And they were very interested in the New York Health Act. They asked me to do the presentation. It went great. And it looks like, crossing my fingers, they will probably endorse the bill. At least they're two locals, and maybe even have the Eastern region do so as well, because Medicare for all on the national level is a priority for them, which is great. And by the way, that sending that flyer to those folks actually helped quite a bit in preparing them for that meeting. But it also makes me wonder whether there's some more, low hanging fruit out there. UE as a union is extremely progressive. It's on probably the extreme end of unions in that respect. It's extremely democratic and quite far to the left. But there might be a few, except setting aside the bigger ones that are either pro or against right now that we haven't thought of to reach out to, and whose leadership, not just the rank and file, whose leadership might be willing to listen to a presentation like that and at least consider it. So, if anyone has a thoughts along those lines or a contact at a union that might fall into that category, please let me know, because I'd love to have that conversation with others, or invite others who could join into it as well to make the case. So in addition, I was wondering if Bob would give us an update on what's going on with the cross retiree organizing committee in pushing back against the changes to their health benefits.
Sure, thanks, Jeff. There was a hearing of City Council Committee on the budget on the 28th of October. And we had a demonstration outdoors, and then we filed into the hearing room where a number of us actually made statements to the committee and to the head of the committee and some other members who were there. It was very well attended. We actually, I think, had 70 people came into the physical room, the city council room, and I think there were about 20 of us that made statements. Plus, there was a group of us that sort of like got together outside for about an hour and made the public had a statement and made the public aware of that. So that was a very successful. It was sort of a surprise that committee would actually call hearings on this issue of privatization of Medicare for public retirees. There is another hearing. This one is only remote, and it's out of the mayor's office, but statements will be accepted online, so people are actually revving up for that. Another thing I just wanted to announce, besides the cross-union organizing committee, is that there are 6 groups within the United Federation of Teachers. We have an election coming up in the spring, and this issue of health has come into center stage, really both for retirees and active teachers, because there are indications that they really want to move along the privatization route, after they finish the retirees off to get, and they actually have begun. New first-year teachers are forced into a HIP plan and don't have the freedom of that other teachers have. I think that's just the beginning. So we're now a unified opposition. All 6 groups are united behind the slate, and we'll know this definitely by next week, this Saturday actually. But we're pushing for a major part of our slate being the New York Health Act. So that's big. And I know there's something else going on the inside. Some people are trying to talk to our president along the lines of maybe putting some pressure in terms of a shift. But so there's pressure growing outside and inside. I'm a little hopeful that maybe something might come of it. So the other thing is that in the opt-in and opt-out, out of our retirees, 10% of our retirees so far have opted out of the new plan. This is very important for us, because if we reach enough people to opt out of this new privatization plan, that the companies may not see that much profit in it. We now have about 25,000 and growing members who have opted out, and at great penalty, at great cost. They actually have to pay for opting out. They have to pay $191 a month in a penalty. So, and they are still opting out. 25,000 of them. People want to keep what they have and don't want to go with the private plan. So that's my report.
Thanks a lot, Bob. And that's it for the labor working group.
So for the hearing on Wednesday, if people are interested, it's a call-in thing. So, and you can give testimony and you can also listen. So here's the chat here's from the agenda, just the email address if you want more information. But it's November 10th. And I think it's at 10 a.m. But if you want to testify, you would call in a little bit earlier, like 9:45 a.m.
Thank you, Naomi.
Mm-hmm. I think this is huge, like cross-union organizing, retiree or otherwise, it could be just a really powerful tool. So I'm just heartened to hear that that's going on. Okay, all right, so now it's the week of action. Some of the events that we have during the week of action include storytelling. Oh, November 9th. This is actually before the week of action, but so first I want to go through the actions that are either online or, statewide, because there's like a few that are downstate. But first, for the things that apply to everybody, the Campaign for New York Health has its storytelling training tomorrow. So it's not just for how to tell your story, but it's also for how to elicit good stories from other people. If you're looking for having people come with you to make the pitch different places, you want to help them develop what their story is like. So there's a link in the agenda to that. That's tomorrow. We have an outreach phone bank, November 11th, also through the campaign. 6 to 8:30 p.m. and also Zoom and remote. We have the Hudson Valley Demands New York Health tabling in Beacon, November 14th. Trainings through the campaign for writing letters to the editor. That's on the 22nd, so that'll be after the week of action. Okay, I think those are the statewide and Carrie.
Yeah, I didn't have anything definitive in time for the agenda, but Doug Bullock and I are working on doing tabling during that week of action. And I have contact at this very popular big food co-op in Albany. So I just don't know when they're going to let us do it. So, but it's going to happen. That's why I want to print postcards, because I think postcards are great for tabling.
Do you want to mention?
I did send Doug some flyers, a bunch of flyers.
I'm reaching out to her about something else.
Oh,
So anybody who's interested in tabling, flyering in Albany can reach out to Carrie and or Doug Bullock. And let us know if you need that contact info. Helen Krim has been holding weekly flyering at Marble Hill Houses, which is like the northernmost tip of Manhattan / the Bronx, perhaps. Yeah, when is that exactly? Oh, you're on mute.
I did it every Monday and Wednesday through October. I'm going to do some more of it in November. I've been away and I'm just back. So I have to set it up for next week, starting next week. I'll go until it gets too cold.
Ellen, let me know about that so I can put it in the calendar also.
Okay, will do.
Thanks.
Okay, other events that we have for the week of action. We're having a big downstate rally on November 20th from 2 to 4 p.m. That's on 125th Street in Adam Clayton Powell. We're teaming up with the Northwest Bronx Clergy and Community Coalition, which is a great big organization. They're bringing busloads of their members to the event. And it's going to be co-emceed by Semilise Lopez and Adolfo Abreu. We have some good speakers lined up through PNHP, et cetera. I talked to somebody with the Cross Union Retiree Committee today also about it. And NYPERG, research in the public interest. Anyway, it's a few different groups and it should be an exciting and good time. So Saturday, November 20th from 2 to 4 p.m. at 125th Street. But that week, we're also going to have a couple of other events. We're going to be tabling and flyering at the Long Island Railroad, Penn Station rush hour. That one's from 4 to 6 p.m. And then also Staten Island Ferry waiting room and or on the ferry itself. There is a link in the agenda to get more information about dates, times, locations. Oh, strange. Okay. So that, interesting. The link's not working. I'm gonna get a link. Ting, I think I put a link in an edit, like a edit version, like comment.
This is for the 11/20 event.
Yeah, it's like a thing where you can sign up for all of the different events that week.
Oh, from New York Health.
It's through just Ganny, I think. Actually, I'll get the link right now. And
Oh yeah, I think Earl sent one earlier. I don't have it
Okay.
handy though.
okay.
I
no
think I know
problem.
what you're talking about.
Um,
While you're looking for that, you want me to talk about the NYPAN launch?
yeah.
Okay, so NYPAN is doing some reorganizing to get us a bit more clout. And we're going to be organizing our chapters based on counties going forward, not just on random spacing where we are, which leaves lots of gaps and causes problems and makes it unclear to outsiders who we are and where we are. So going first up is Manhattan, where we've got 4 chapters, and even the 4 chapters don't cover the whole borough. So we're going to have an all county Manhattan Progressive Action Network chapter, which is launching on Thursday, the 18th. And you may have all heard of this already, but so I'll be brief about that. But we're doing it in conjunction with our Revolution, which NYPAN is now the New York State official affiliate of. So they're putting a considerable amount of muscle and effort into helping that launch go well. We're going to have Jamani Williams, Zephyr Teach Out, and some surprise guests. Should be a fun evening. And it's going to be at on West 37th Street in person, and it's going to be through live stream if you don't want to go. But if you can go, it's going to be a really fun night, I'm pretty sure. Anyway, relevant to this group is one of the things we're going to do is show people who come us in action. So for instance, Luis Ordonez is going to be going around with the clipboard, signing people up to join the how to be a candidate training, specifically for state committee, but it could be used for other things too. And I want to have some people going around with clipboards to join the single payer committee, of course. So if anybody wants to do that, just get in touch with me, or even just show up if you want to, but that has to be in person, obviously. And that'll be very helpful. That's it.
Are there other events that we don't have listed in the agenda during that week of action, or just that are coming up this month? Yeah, Emily?
Unmute. We don't know the exact date yet, but Assemblywoman Anna Kellis is going to do a fundraiser for the New York Health Act, or for the campaign, as well as launch her own bid for re-election in one big, hopefully kind of swanky, invite all the sort of people who have deeper pockets around Ithaca, and get music and drinks and all that stuff, and hopefully raise some money and awareness, get people signed up.
Very cool. That'll be later this year, or do you know when?
It was going to be on the 14th, but then it fell through, so they're still scrambling to schedule the right place and time. But
Cool,
in
that's
within a week or
exciting.
something of that.
Emily, let me know about that so NYPAN can promote it.
Yeah.
Susan?
Also, a couple of us from Finger Lakes for New York Health are going to be tabling at a couple of nursing community colleges that are here in the area to get people to sign on with the QR codes and to get them some postcards as well. So a few of us plan to do that during the week of action.
Great. What is it? Where did you say? A community college?
Yeah, there's two in the area that have nursing programs. And so we're going to be table outside of like the cafeterias or the nursing labs when they have in-person labs, because they can't do that remotely. And there's Tompkins Cortland Community College and Corning Community College. So that's in Tompkins County is the first one, and the other one is in Steuben County, where Corning is located.
Got it. I think, okay, we can clean that up, but that's okay. That's awesome. That's great news. Carrie, you had a comment, question?
Yeah, I was just thinking about what's the potential for publicity with all of these events and tabling things? I mean, we need to make sure to get pictures, and where do we send them? How will they be used? It just occurred to me that we have to think about that from the whole, this whole state and this whole week of action.
Yeah, so we have that the toolkit or whatever it was that just like something that you can use, a resource when you're tabling. And one of the things that it mentions on there is about taking pictures. It is a great idea. We have a Twitter, well, at least through NYPAN, we have like a Twitter that we, and a Facebook page where at least those are kind of like Facebook, it's like a landing page, and I think that is useful just simply when we have future events that we are like, that we're using our Facebook page to advertise with, and people can like look around and see like, oh, they really do have things going on, whatever. It just makes it more, it fleshes out like what it is, the extent to which we've been putting in all of this work and connecting with people. But if you have other ideas about how and where to use pictures,
I suspect we also, Ting is great about posting things and getting things on the website and Facebook, but maybe the campaign can also use a lot of this, because that's where the idea originally came from, isn't it? From Ursula.
Yeah, absolutely.
So they could probably, I don't know how we're supposed to, or where do we send them, or can Ting, can you be the clearinghouse?
Sure.
For all of the photographs that come in?
Sure, although the reason I raised my hand was to ask about press releases, because I think the one for the 20th, the press are already invited. Is that correct? Anybody who's organizing that, or?
A big rally.
Yeah,
Why?
there's
If you have press
speakers, so-
contacts, like we want them. There are people reaching out, but any more is useful.
right.
And I think
can
with the
send to
pictures, first off, just take the pictures and then get in touch and we'll get them to the right places, no problem.
Well, I was thinking the local press is also very useful for people outside of the city, which I can't organize, but
Yeah, absolutely. Susan.
I'm sure if you send them to Ursula and Yulin, they will be in a good position to post them through the campaign website.
I think so too. Yeah.
What we're going to do up here for the part of this fundraiser that Emily was referring to, I also am a member of New York State Senior Action Council, who is a big endorser of the New York Health Act. And we had pictures taken with people holding up a placard in front of them as to why they are for the New York Health Act. And it was like putting down a little bit of their story, except in just a couple of lines, and then that they would hold that up in front of them. And then they had the picture taken of them with their sort of endorsement of the New York Health Act due to what they've been through with health needs or care or that sort of thing. And we found that very effective, and people really liked it.
Yeah, that's a great way to get good pictures.
I just
Okay.
I just had an idea that we could have like a card that starts with the New York Health Act is important to me because, and have somebody write a message and take a, people that come to tables, take a picture of them with that sign.
Yeah, and you could even print that on a piece of paper just with large print and a couple of like big lines going down it just on a regular piece of paper. I think that
Do it on 8.5 by 14 page. Yeah.
the
Yeah.
campaign had them for some of the Albany trips. So you might want to check with Ling and see if they still have any left.
Okay.
okay, well, it's just about 8 o'clock and we've gotten through the agenda.
Phew.
Yeah, we did it. So, all right, well, it says new business on there, item 10, but I think that I kind of feel like we got through a lot of the questions as they were coming up. So,
Bob has his hand up. Oh, no,
No.
sorry.
My thumb up. I'm finishing the agenda.
yeah, we did. I think this is great. All right, so is there any loose ends or are we good?
Is the agenda in the invitation? Or
I'll
is
send
a
it out
separate-
again.
Thank you.
The agenda's in the chat.
What?
In the chat many
Oh, good.
times. The agenda is.
There we go. Here's a link. I just posted one more.
So I just want to say, I might just come down for that, what is it, on the 18th, that launch?
Oh, yes.
Because it sounds so exciting, but I'm relinquishing a plan to Donald to go to the Athens Village meeting when they're ordering, they're talking about ordering a fire truck. And I want to recommend that they order an electric fire truck. So I have all this,
Yeah,
three
that's more
different
important.
companies, 3 different companies that produce these, and it may cost them a few $100,000 more, but they're not going to be buying gas.
Yep.
They're coming into this century. So I may let Donald take that task and I'll come down to play with my NYPAN buddies.
Okay.
Thing you mentioned that there's this move to create county
Chapters. Yeah.
chapters. How about the Bronx?
They're working on that. Brooklyn is probably going to be next. There's 2 chapters in the Bronx currently, and they're in discussion. Haven't been part of that to know where they are because I've been too busy with Manhattan. But I know, I think Brooklyn is scheduled to launch in
Wednesday,
January, and the Bronx would be the next
then
one
the
after
school
that,
board.
probably.
Okay. I'm assuming that Gene Binder might know something more about that.
Yeah, I think Gene's been talking with, I don't know who. Oh, with Nestor, I think. Yeah, by all means, give him a
Okay.
call.
Thank you very much for a good meeting.
Thanks. Steve.
Good night.
Yeah, good night all.
Good night. Take
See you in
care.
the streets.
Yes.